Hey, future medics. Today we're going inside the body, quite literally. We're going to start talking about body cavities, which is the spaces in our body that hold our organs and protect those organs. And knowing where things are in the body and how it is organized helps us predict in EMS where injuries are based off of the pain that a patient is feeling and what organs live there. So let's get into it and we'll make it easy. Now, what is a body cavity? It is just an area that holds organs. Think of it like a room in a house. It is separated by structure and function, and it is for protection. There are two main body cavities in the body, and it is the dorsal and the ventral body cavities. Now, the dorsal is on the dorsal aspect of the body, which you remember from when we went over body positions and planes. And the dorsal cavity holds the cranial vault and the spinal cavity. So the cranial cavity and the spinal cavity. And all of these structures, your brain, your spine, are wrapped in meninges, and we'll get into them more specifically later. But when we are thinking meningitis, intracranial pressure, we are dealing in that dorsal cavity because that is where the central nervous system and the meninges are located. Now let's talk about the ventral cavity. It is on the ventral aspect of the body, the front of our body, and it holds a majority of our major organs. It has two distinct subdivisions, the thoracic cavity and the abdominal pelvic cavity. Now, looking at the abdominal pelvic cavity is really interesting, and we'll get into it more later, but notice how it's one big space but two regions. That is interesting, and there is a reason for that, and we'll talk about it later. But knowing where organs lie in your body almost gives us the ability to predict an injury, or at least things that we should probably be concerned about and keep a very close eye on. So, for example, if you have a penetrating trauma to the lower back, that is entering the dorsal cavity. What is in the dorsal cavity? The spinal cord. So, we need to be thinking about spinal cord injury and testing myotomes and dermatomes. Can you still move? Can you still feel? But when we're talking about maybe some rigidity in the abdomen, we think about what's there. It could be peritonitis, maybe their appendix ruptured, maybe they're having some internal bleeding from trauma. Knowing what is in there helps give us insight to what could be going wrong. Now that you understand dorsal versus ventral, we're going to do some videos really zooming in and taking a look at what's inside of each one. Now, this is where you really start connecting anatomy and medical emergencies and understanding how they go together. And I'm telling you, almost getting a sixth sense about these things and a little bit of ability to predict what's going on. You're doing a really good job. We're building this layer by layer, so it's not so overwhelming, but I know you can do this. You're doing a great job. I believe in you. Even if you don't believe in yourself right now, that is okay. I'll see you soon.